Hi, everyone. I'm John Schmidt, Senior Vice President of the Value-Based Care Exhibit Hall, and I want to welcome you to this week's Exhibit Hall Flash interview. And today, our guest is Terry Hush. Terry is the CEO and co-founder of Roji Health Intelligence. And Roji is a very valuable resource, and it specializes in helping value-based care organizations prepare for downside risk, very important, by developing strategies like successful provider networks that reduce cost and improve quality. Terry will tell us a little bit more about that in just a minute, but Terry's a very prolific writer. I'd encourage you to visit both their Value-Based Care Exhibit Hall booth and website for really very valuable blog posts, white papers, and other timely information. So again, encourage you to do that. So again, welcome, Terry.
Well, thank you very much, John. And thank you for referring to our blog and educational articles, because there are a lot of really good content.
Very, very much so. So I've just got two questions I'm going to ask you, Terry, and then if you could just respond back for us, that'd be great. And the first one is, why do value-based care organizations, like ACOs and APMs, need the services of Roji Health Intelligence? And in the process of just answering that, maybe tell us what sets Roji apart from other companies that are offering similar solutions. I'll turn it over to you at this point.
Okay, well, thank you very much. Well, Roji helps providers achieve peak performance and growth through alternative payment models. So we're talking basically about moving to population payments, which puts providers at financial risk. And then without understanding where they're going, through data, it will be very hard for them to achieve both financial survival as well as prosperity. So we provide the technology infrastructure for value. First of all, we start by aggregating EHR data and claims data into a platform that gives them the data-driven tools to improve outcomes, address health equity, and costs. Roji also performs APP and health plan reporting, which is something we've had a long presence in on the MIPS side for, 10 years now and counting. In terms of how we differ from competitors, I think there are three ways that I'd like to focus on. First, you won't find a company that has more experience in EHR data aggregation than Roji. We've been doing it since 2002, when there were very few EHRs around. And then we've progressed since then. And that gives us deep expertise in mapping and using patient data that groups need for effective strategies in value-based care. Second, Roji constructs patient episodes as an instrument in the backbone of data-driven improvements. And why are they the backbone? Because they're clinical patient experiences based on diagnoses and procedures or other criteria to capture all the outcomes and costs in a period of time. What episodes do is show the differences between patients and providers for the same basic care. And without episodes, you're basically looking at individual services and really can't compare the costs or identify drivers. But episodes act differently for procedures and for conditions. The procedure episodes are really targeted to specialty services, and they reveal cost variation and drivers across the procedures of a particular type. That enables groups to have a conversation with specialists about the reasons for the variation and work together to create change. Chronic disease episodes, on the other hand, identify patients at risk in those chronic conditions. They show patients who have been lingering in poor control and have progressed, for example, to kidney failure. Roji creates a bridge between episodes and population health for targeting specific interventions for clinician review, like changes in medication. For example, an episode of diabetes will identify patients who've had very poor control in diabetes over a long period of time, yet are on straight insulin and not on any of the newer medications. Through population health, care navigators can investigate whether this is a financial issue or a patient obstacle, or whether it's a clinician decision, and open the case for clinician review. And then by changes in that medication, you have potentially big effects on the outcome in stopping the exacerbations that show up in the emergency room or admissions or progression to further disease. The third thing that I'd like to emphasize about Roji is that we've been a qualified registry for MIPS, which is Medicare Quality Reporting, since the inception of Medicare Quality Reporting. In combination with our data aggregation, we can perform APP reporting for ACOs and build a robust value-based care technology for those same entities in one go of data aggregation. We create custom measures for condition episodes as well as health equity, and that helps groups develop and share metrics with their own providers. So those are the things that really distinguish Roji from some of the competition. Very clinically focused. We're going after the big ticket dollars, and we're not just simply using claims data to evaluate what should be done to start reducing costs.
Well, thanks, Terry. That that's a lot of information, I know, in a short period of time. And for that reason, I would encourage everybody to visit the Roji Health Intelligence booth in the Value-Based Care Exhibit Hall. And there's a lot of information there, along with the resource information. Like I said, Terry's a very prolific writer. And you can get more information, the blog information, by going to the Roji booth and also to the website. So thank you, everyone, for joining us. I know this has been helpful, and special thanks to you, Terry. And let's say goodbye for now.
Thank you, John.